At Holy Cross, we're very excited about TAVR, which is Transcatheter Aortic Valve Replacement. It's a procedure that we use to treat patients that have a disorder called aortic stenosis, which is when the aortic valve doesn't open well. It's a fantastic procedure that we did our first one of in May of 2012. We were the first program in Broward County to do transcatheter aortic valve replacement.
But over the last 12 years, we have seen tremendous improvements in this technology. We have seen several new generations of devices that are more reliable and effective. The procedures are now being performed on younger and healthier patients and is considered a possible option for all patients with aortic stenosis.
In addition to being able to deliver the valve through the arteries in the leg, we also can now deliver the valve through arteries in the arm or through an artery in the neck called the carotid artery.
Dr. Font was washing the aortic valve, that there was something wrong with it. And he decided that I needed the procedure. And then from on, everything just, it was like a teamwork. They all work in a way that was amazing. So honestly, it was wonderful. And the next day, I was out of the hospital. 2 weeks later, I started feeling like I haven't felt. Like incredible, full of energy, and something else that is amazing. A new person. No anger. I'm going to cry no, it's like you were born again. And that's it. That's all I can say.
Generally speaking, in today's world of transcatheter aortic valve replacement, most patients are at least considered for this technology as one of their options.
All procedures are performed by a team of interventional cardiologists and cardiovascular surgeons. And we continue to perform our cases in a hybrid OR, which is set up for catheterizations, but also available for open heart surgeries if the need arises. By sticking with these basic processes, we've been able to ensure optimal results and safety.